Hello, everyone. Welcome to Eldercare Academy. This is our training series for insurance agents. I am your host this morning, Adrienne Ostras. I am the Digital Marketing Director here at Eldercare, and today's topic is going to be specifically on quoting during the Medicare annual enrollment period. So this is going to be for those agents who need to know where to go for quoting Medicare Advantage plans, prescription drug plans, and Medicare supplement plans. Thank you so much for taking the time to be here live with us this morning. I know that this is a very busy time of year and your time is very precious. So thank you so much for spending that time with me this morning. Just a few housekeeping things. We do want this to be a conversation, so please find the Q&A box. So if you're watching on Zoom, it'll have a little square with a Q&A in it. Just pop that box open and that is how you can communicate with me. And then if you're on Facebook Live, you will simply just comment live on the video and I can get those questions answered. And I am going to go ahead and start sharing my screen. And when we start talking about quoting, I do want to stress that this platform I'm going to be talking about is your go-to for all of your quoting and enrolling, right? You can be doing applications on here as well. You can be doing scopes, call recordings, all of that. But I'm going to talk just only on the quoting this morning. If you are curious about the other features, please just reach out to us. We can send you those training videos or do a training with you to get you confident in the platform. So officially, the platform is called IntegrityCONNECT. Some of you might have known it as MedicareCENTER, but it is now called IntegrityCONNECT. You will still go to integrity.com to access the platform. So you'll notice in my URL here, it says integrity.com, and that is where you will log in to do your quoting. If you're new, this is also where you will sign up for the platform. So you will go to integrity.com, you will click login. If you are new, you will click sign up right here at the bottom. And then if you have been using MedicareCENTER, it's going to be the same login credentials, your NPN password, all of that is still the same. And then you will log in. And then when you get logged in, this is what we're calling IntegrityCONNECT. This is the dashboard that is formerly MedicareCENTER, but now IntegrityCONNECT. This is where you will do all of your quoting and enrolling. There is no need to go into Medicare app or Medicare Link anymore. Those two platforms are still available to you. I know a lot of you, have been using those and they're still there, but eventually we will be removing these, okay? So this AEP, I highly encourage you to get familiar with staying in this IntegrityCONNECT platform, okay? And before we get into adding some prescriptions and doing some quoting, I want to talk about like the number one kind of question that I get this time of year or, kind of any time of year. And that is, agents call in and they're saying, I'm running a quote, but it is saying I'm not appointed to sell this plan, but I know I am. Okay, so that is the number one question that we get here at Eldercare. And I'm just gonna kind of show you how to confirm what you're ready to sell with. And how you do that is you click your profile icon in the top right corner, you go to account, and then you will go to selling permissions. Okay. Then you will click health. And this is how you know, like 100%, yes, you are contracted, certified, ready to sell with these carriers, with these products in these states. Okay. And then I'm going to explain maybe why they're not showing up in the quote for you. But in your selling permissions, this is how you know you are 100% certified, ready to sell, ready to write these products, okay? And if you feel like you're missing one, just reach out to us and we can help you do that research. But hopefully everyone's already done all their certifications. Now I'm going to go back to the main dashboard and we're going to talk quoting because there's technically two different ways you can do a quote on here. The first way is to come up here to the top dashboard. This top little toolbar you should see, it should say quick quote. So this is the first way you can run a quote. You would click that. It's going to ask you which products. So for this training, we're doing health. It's going to ask you for a zip code. And some zip codes have multiple counties, right? We got to know the county for a Medicare Advantage plan. We're going to hit confirm, and then it's going to take us right to the plans. Okay, this is the quickest way to see what's available in an area. You can work your way backwards. You can start saving this information to a contact record. That way you'll be able to go back and enter in drugs and do the enrollment. But if you're wanting to run a quote very fast, see what's available, you can just come up here to quick quote, enter that zip and county, and then you can see what's available. This is a really great way to see quickly too, what's commissionable or not commissionable, okay? Green check means commissionable, red minus means not commissionable. By default right now, it is going to quote 2026 plans, okay? You'll notice up here at the top, right, these are where the filters are. So by default, it's doing Medicare Advantage prescription drug plans. It's doing January 2026 effective date. Because I don't have a pharmacy in there, it's doing mail order. And then it is showing right now, you'll notice here under additional filters that my appointed plans is checked. So right now it is showing the plans that I can write on the platform. I know that wording can be very confusing. If you're on this screen and this is checked and you're missing a plan that you know you're ready to sell with, right? You checked your permissions. You're like, I know I have this Cigna PPO, but it's not showing under my appointed plans. It could be for multiple reasons. Okay. The first reason is it could be not commissionable, and the carrier doesn't want you writing not commissionable plans on the Integrity Connect platform. Or it could be that the carrier is, trying to slow down the enrollments in that type of plan. And then it could also mean just the carrier wants those types of plans to be written on their portals. So there could be multiple reasons. The number one reason is the carrier has, made that decision to not allow agents to enroll those plans on the Integrity Connect platform. Now, I know that might make you think, well, then why do I need to be on Integrity Connect? Even though they might, suppress the plan from being written on here, you can still quote all plans on here. So I highly recommend that when you are quoting on Integrity Connect, that you scroll down on here under additional filters and uncheck my appointed plans. This will show you all of the plans, just like you were quoting on Medicare.gov, okay? This will show you all the plans, whether you're contracted with them or not, whether they're commissionable or not, and then whether they're suppressed or not, okay? And then the ones that you are able to do the enrollment on will have that apply button. The ones you can't write on here will just not have an apply button, right? But you'll still be able to quote it and still figure out, which plan is going to be best for them. It's just, it might be that depending on the plan, you still have to go to that carrier portal to do that application. You'll notice for 2026 plans, the apply button is grayed out. I do have some agents call and it's like, why can't I, apply? And that is because it is not October 15th yet. So this for 2026 plans will be grayed out until the 15th. You can come over here to the effective date and change it back to 2025. So if you do have folks needing, a PDP plan or a Medicare Advantage plan, effective November, you can still do that on here. You just change the date. And then now you'll notice that apply button is blue and clickable. And I still have my appointed plans unchecked. So as I scroll through here, I'll be able to see the ones that the carriers might be suppressing. So this WellCare Give Back Dividend, does not have that apply button and it could be that I'm not contracted, or it could be that the carrier has just suppressed it. So I'm still able to quote it, just cannot do the enrollment on here. And as I scroll through, there will be multiple pages. Again, you'll see whether it's commissionable or not. I was trying to find you a not commissionable one to show you the red minus. Here's one. So this Aetna Medicare Value Plus PPO has that red minus for commissionable. And I will say that some of the plans that are non-commissionable, you can write on here. So that's at the carrier's, level too, whether they want to allow that or not, on our platform. So for example, WellCare PDPs, they are non-commissionable, but you can write them on here. And then this example here, this Aetna Medicare Value Plus PPO, it's non-commissionable, and you cannot write it on here. So you will know what you can and can't write on here pretty easily, okay? Do I have any questions about that? Because that is the number one question we get. Hopefully everyone understands that. So that quick quote that I did, that was the first way to run a quote. I only do that if I'm trying to see very quickly what's available in an area. If I know I'm going to be entering in prescriptions and pharmacies and doctors, I'm going to want to save that work, year after year. I want to be able to save that. So I'm going to start doing a quote by creating a contact. And you have two ways to do that. I'm going to go back to the dashboard to show you. So if you see this little plus sign in the top right corner, you can click contact here, and that'll take you to this screen to create a new contact, very quick. And then the other way is to go to clients over here on the left-hand side and then add new. Okay. And then when you're creating a contact, the only required fields are first name, last name, phone number. So if you are in a hurry, you can do just first name, last name, phone number. But I highly recommend filling everything out as much as possible. And I recommend this because it will fill into the quote. It will fill into the scope of appointment. It will fill in to the application. So it saves you a lot of time on the back end, right? If you just enter all the information in first at the beginning, you won't have to do it again. So I'm going to show you how to create a contact. I'm going to do our address here at Eldercare. I will say zip code is very important. Everyone should know that. We need to zip in a county to be able to run a quote. And then email and phone number are here. You only have to have one when you're creating a contact manually. But if you have both, highly recommend that you do both. And we will verify the email and phone number that they are entered in correctly. So this phone number was verified. It can receive text messages. And then this email, it'll be verified that it is typed in correctly and can receive emails. And then you can put in their Medicare number, Part A, Part B dates, if they have Medicaid, and if they have LIS. And then you hit create contact, and then it'll automatically take you to the contact record. And then this is where you can, save all the information for your contact year after year, right? Saving information is such a big deal. You don't want to have to enter in information and then maybe your window freezes, you have to shut it down and then have to re-enter it. You don't want that happening, especially during AEP. So be sure that you're utilizing this tool to save your work, right? So we're focusing on quoting this morning. So I'm going to jump into the medical profile here. You'll notice the little blue square that says medical profile. And then this is where you can start entering in the providers, the prescriptions, and the pharmacies. And I will let you know that the providers, prescriptions, and pharmacies, that pertains to Medicare Advantage quoting. Health info over here on the left and conditions here at the bottom only pertain to the life side of the quoting on here. So during AEP, you don't have to worry about doing this health info and conditions. You can just start doing the providers. When you are entering in providers, I do recommend that you select all of the addresses. So you'll notice here, Kevin Hale has multiple addresses. And this can happen because he maybe still has an old office still listed somewhere on some documents. And then this can also happen because the doctor can have his practice and, see you at one location, but he can technically do his billing at a different address. Okay. So this is kind of why it's important to select all of the addresses to know which one he's filed with the carrier as in network. And then I'm going to click add provider. And then this is also where you can add hospitals. So here we have St. Vincent. You'll notice like this says family practice, family practice. I'm looking for the hospital. I believe ours is going to be on page 2. So here we'll see hospital. And you can also search by the field they're in. So if you're looking for a dentist, or you are looking, for a heart doctor, you can search by the field they're in as well. Now I'm going to move to prescriptions, which is, I feel like, the most time-consuming part of AEP, right? is trying to enter in prescriptions and quoting prescriptions. They are quite complicated with their names, all the versions they come in, and dosages and frequency. It's all really important that you enter this information in correctly. And I have a few I'm going to enter just for quoting purposes. So I'm going to start with Synthroid. It's a brand name drug. It's telling me here brand. And then it's going to ask me, would I like to use the generic version? So if there is a generic version, it will say it. So it's up to you to either switch it to the generic or keep it the brand name. And then you'll notice like through here, you got to make sure you keep scrolling because it could be different forms that it's in, but it looks like this one is just tablet. If you're curious, if both are covered, you can come in here and add both the brand and generic. You can always come back to the prescriptions and remove it. I like using Lipitor for a good example. No one covers this brand name drugs. I'm going to show you what it looks like when a drug is not covered. And then I'll do metformin. So here you'll notice there's a solution, there's a tablet, there's ER, which is extended release. So a lot of carriers don't cover extended release. So make sure if the doctor is prescribing that you're entering it in here. And then modified release. I mean, it's really important to pay attention to all of this. I'm going to do the 500 tab, extended release. And then I think I'm going to try a tier 3 drug to show you what that looks like as well. Okay. And then next is the pharmacy. If you're wanting to quote for mail order right now, you have to leave the pharmacy blank. We are working on, making it a toggle so you don't have to come back and add pharmacies and then come back and delete them. But if you are wanting to quote mail order, you just leave the pharmacy blank. You can add up to 3 pharmacies. That way you can quickly toggle when you're in the comparison how much it's going to cost at the different pharmacies. And then once you have all of their information entered, I'm going to scroll back up to the top of this contact record. And then you'll notice this big blue start a quote button right under their name. So you'll click start a quote, asking the product again, health. And then here I am again on the quote screen. Depending on the specific prescriptions that you're putting in here, our Ask Integrity feature, which is our built-in AI digital assistant, will let you know that you might have a prescription in here that is only prescribed by a specialist. So because I put that Lipitor in here, this little AI window popped up and said, hey, based on your client's prescriptions, they might see a specialist. Like it's reminding you to ask for that specialist. If you already have it added, you can just continue to plans, but if you forgot, you can come back to the providers and add it. And so again, when I'm on this screen right away by default, it's doing Medicare Advantage prescription drug plans and it's doing the plans I can write on here, okay? So I can scroll through here and these are all the ones I can submit an app on, okay? Hopefully everyone remembers that I suggested coming over here to the right-hand side and unchecking my appointed plans when quoting, okay? I'm gonna change it to 2025 real quick just to kind of show you that apply button. And then I'm gonna come over here and uncheck my appointed plans. Okay, so now I'm in that environment as if I was quoting on Medicare.gov and I'll be able to see if they're commissionable or not, if I can do the app on here or not. And then what's covered and not. So now that I have everything entered in, you'll see here on the little preview that it's giving you the premium, the estimated monthly drug cost, the medical deductible if there is one, the out-of-pocket max, the drug deductible, estimated yearly drug cost, and you'll notice here in italics, it'll tell you based on the effective date. So this estimate is for the year starting November. And then you'll notice these little blue text here. These are clickable. Like this is one of my favorite features when quoting. You can click this text and it's going to give you a really quick preview into what's covered and what's not covered. And this is great because you don't have to go into the plan details to see this information. You can just see it very quickly, what's covered, what's not covered. Same with the providers. So it's telling me that, Kevin Hale is in network at this address. So if I wanted to, I could come in here and remove all of these others if I wanted to clean it up, but I know like he's in network here and the hospital is in network. Oh, he's in network here and the hospital is in network. And then I can click the prescriptions and real quick, it's going to show me what's covered, what's not covered. More on the filters over here on the right-hand side, you can switch to PDP. When you are changing the filters on here, it is really important to let the page load. If you're clicking things before the page has finished loading, it's not going to load correctly or it won't load for you. So highly recommend letting the page load before you start changing filters. Effective date, this is where you can change the pharmacy. So we know that Walmart's in network, but if I want to see, if they get it filled at the national park, what that cost is going to be in comparison. So you'll see the pricing updating. Like that total estimate goes from 1,300 to 2,100. So we want them to go to Walmart. This is also where you can select special needs plans. Make sure you are on that Medicare Advantage, but you can select special needs plans, which there's no special needs prescription drug plans. So I need to come back up here to Medicare Advantage prescription drug plans, let it load. And then now make sure my special needs is checked. And this is where you can see all the special needs plans. Okay. Again, this is why you want that my appointed plans unchecked. Same with special needs plans. It'll show you the ones you can write on here, and it'll show you the ones you can't write on here. which I think UHC is mostly the one you cannot write on here. You can do the includes Part B filter. You can filter by specific carrier. So if I just wanted to see United Healthcare, I would be able to see just that carrier. And then I could see the ones I can write on here versus the ones I cannot write on here. So I know I'm licensed to sell with both of them. It's just UHC wants us to write those chronic plans on their portal. And then you can also sort by PPO or HMO. Those filters are very important. So I'm gonna get out of special needs for a minute and get out of just United Healthcare. So on this quoting page, this is also where you can see the star rating. This is where we give those AI cross-sell recommendations. This is also where you can do side-by-side comparisons. You can compare up to 3 plans side by side. You just select them and hit compare. And then once it loads, this comparison, you can share it with your client. You just click share. You can share it via text or email. You can come through here. This show more is where it breaks it down by month. You know, it puts it side by side, what's covered, what's not covered. So that's how you do a comparison. I'm going to go back to the main quoting page. I will say you can change the sort here at the top. Most all agents sort by lowest total estimated cost, but if you wanted to sort by premium, star rating, out of pocket, you could do that. And then I'm going to go into the plan details on a plan. So you'll see here, plan details. This is where it breaks it down into even more detail for you. So this is where it's going to show you, again, the star rating, the name, the prices based on this pharmacy, premium. This is where it breaks it down by month, which I can, let me go back to 2026 so I can show y'all what you will all be looking at. Let that load. Now I'm back to 2026. I'm going to go into this plan details. And then here's the whole year. So I can just expand these months. It's going to say the premium, the drug cost, and then it'll add the 2 for the total estimated monthly cost. Okay. And you can see that for every month. It even tells you the phase that it's in. So if you're on that phase, it would say deductible if it's in that deductible phase. This is where it says the tiers. So tier 1, tier 2, this is where it also gives you restrictions. This is really, really important. Make sure you're checking those quantity limits. Make sure you're not entering anything above that. This will also tell you if there's pre-authorization required. This is where it will tell you if there's a drug not covered. As you keep scrolling, this is where it tells you what's covered, what's not covered, who's in network, who's not in network. And then it goes into the plan benefits. So inpatient hospital care in network has a $360 copay for days 1 through 6. This is where you say, I have another plan that can help cover those copays. You know, that's where you put that plug in for that hospital indemnity plan. As you keep scrolling, doctor visits in network is a 0 copay. Chiropractor, $15 copay. You can use this screen to go over the benefits if you choose. You have another option. You can come down here to the very bottom of the screen, and this will show you the plan documents. So you can click the documents down here. It'll open in a new tab for you. And if you want to go over the benefits from the summary of benefits, you can absolutely do that. That way, you know, you're reading exactly from what the client will be getting. So you'll be able to say when you get your book on page 5, that's where you see your premium and your deductible and your max out of pocket. I will say that Control F is my best friend when doing quotes. Hopefully all of you are aware of that. When you're on any browser window on the internet, you can just hit Control F. You can search that benefit, hit enter, and it'll take you to what you're looking for. So you can do that on this benefits page, or you can do it on the summary of benefit document. When you are in a certain plan's details, you'll notice there is a share button on this one too, but this doesn't share like your screen like the comparison does. This share button within the plan details only lets you share the documents. So if you're wanting to send your client a copy of the summary of benefits or the evidence of coverage, you can do that. You can send it to them via text or email through the single plan's details. And then I did have in my notes, I wanted to make sure everyone knew when they are entering in prescriptions that if the prescription is an over-the-counter medication, it is not going to be as in there as an option to add here. And we recommend that you don't put over-the-counter medications in here when quoting, okay? I just want to make sure everyone is aware of that. And then I also want to make sure that everyone is aware when quoting in here, because I'm showing you again Medicare Advantage plans, prescription drug plans, which I'll come in here and do a prescription drug quote too. So when you're on prescription drug, again, some of these they will let you write on here, some of them they won't, and it'll tell you if it's commissionable or not. And again, you can go into the plan details, and that's where it breaks it down by month. So if they're just doing the PDP, that is what their cost will look like. So again, I was showing you Medicare Advantage, prescription drug, MA only, those are all on here. I will say that Medicare supplements are coming soon to Integrity Connect. They will be added by the end of the year. Okay, so Medicare supplements are not quite built in here yet, but it is coming very soon. For Medicare supplement quoting, you will have to go into the top right corner here under your profile icon and navigate to CSG app. I do recommend that you get yourself familiar with quoting on CSG app on here and doing the e-apps on CSG. This is good practice for you for when we release our quoting and e-app in Integrity Connect. So once you're in CSG app, you just hit run quote under Medicare supplement. This platform does not talk to Integrity Connect, so you do have to enter in everything again. You'll do the zip code, age, gender, tobacco, how you want it sorted, the effective date, which is really important, if you want pricing with the household discount. And then also, once you put that zip code in, you have access to this Show Advanced feature. So when you click Show Advanced, this is where you can put in health conditions and medications. And then once you do that, it will show you the carriers that are most likely going to accept them. So be using this tool to get accurate quoting. And this is a very busy time of year. Our office is getting calls a lot about running quotes. And so we wish we could answer every call and run every quote. But we have built these tools for a reason, right? We don't want you to have to wait on us. We want you to be able to run quotes as quickly, as accurately as possible. And you can do that in here. So just make sure you're getting familiar with the Integrity platform. Once you enter in everything for the Medicare supplement quote, you just hit get quote. On this CSG platform, it will always show you all carriers. There's not any kind of filters for my appointed or not appointed. It's just always going to show you all carriers on this one. If you can do the e-app on here, it will have an apply button. So as you're scrolling through here on the Medicare supplement quotes, Woodman, for example, you can do that e-app right on this platform. So without having to log into another platform. And then if the carrier is not, if the e-app is not built into here, like it does not have that apply button, you can get to the carrier portal by going to quote options and visit carrier resources. This will take you to the carrier portal to do that e-app. Okay. I think I've covered everything I've wanted to cover about quoting. I'm about 6 minutes over for the training. So I'm going to go ahead and open it up for questions. If anyone has questions on quoting, please let me know. We definitely want you to be confident in using this platform and running your own quotes. I do see Latanya asked, I wish there were more filters. I've played with Integrity, but had some issues with Medicaid options. Yes, that is a great point, Latanya. Our platform does not have all of the Medicaid filters yet, but we are actively working on that. This is kind of why we're encouraging more agents to do their apps on Integrity. The more agents that are actively using the platform, the more features we'll be able to continue adding. So just keep that in mind. If you are wanting to do certain, Medicaid quoting, that is why we still offer the other two platforms. But if you're going to be using these for your dual quoting, I still highly recommend that you come back into this Integrity Connect platform and you do the enrollment through here, okay? Do I have any further questions about quoting? I see quite a few of you still on here. I want to make sure that I'm getting all of your questions answered. And I know there's a time delay, so just think about it and just type them in the Q&A box and I'll get them answered. Steven said, levothyroxine is a good one, tablet versus capsule. That's a good point. So another prescription kind of tip is, pay very close attention to capsule versus tablet because carriers will cover one and not the other. So please pay attention and make sure you're selecting the right one. Carl, why would an agent enroll if they are not appointed? So, Carl, on Integrity Connect, you can only enroll if you are appointed. So you can still use this platform to quote all of your carriers. The only enrollments you would do on here are the ones that you're licensed, contracted, certified, ready to sell with in that Integrity family. So Eldercare, we are a proud Integrity partner. You can get access to do those carrier enrollments on here. Sonia, are you able to have a one-on-one training? Absolutely, we can do that. Felicia, can you talk more on campaigns? Maybe that's a training I do next week, Felicia. But yes, your marketing campaigns you can be doing in here as well. Does it show preferred pharmacies? It doesn't say like in black and white preferred or standard. You just have to come over here to the pharmacy to see the pricing, to see the difference in pricing. If you're looking for a preferred pharmacy, I mean, the best thing to do is kind of ask your rep for a list of preferred pharmacies, or you can come in here to plan details. And this is kind of how I see if the pharmacy is preferred or not, is when you're in the plan details, if you scroll to the bottom, it'll tell you the pricing for standard versus preferred. So if you go through, so standard for a generic, it's 0, 0. The preferred brand is 90, 30, non-covered 35, 33, and then preferred will tell you that pricing too. And then I just look at that in comparison to the drug costs that I'm looking at up here. So that copay is 30, 0. Carl, I meant if there is a non-commissionable plan with one of my carriers, why would I write it? Okay, Carl, that is, you know, your choice, whether you want to write it or not. We just let you know whether the plans are commissionable or not. So you're aware of what you're enrolling in. Scott, to clarify, I can or can't do dual plans on Connect. So you can, Scott, absolutely. So when you're quoting on on here, um, just make sure you have the Medicare Advantage or the MAPD checked up here at the top, and then you will select over here on the right, special needs, whoops, special needs plans. And then yes, you can quote on here. So you'll see um, the ones that you can write on here versus not. But again, I recommend unchecking my appointed plans. So you're checking special needs, you're unchecking my appointed. Now you're quoting all dual, all chronic, all special needs plans. You're able to quote all of them on here. But when it comes time to do the e-app, you'll be able to see which ones you might have to go to the carrier portal to write. So this WellCare dual access, I don't have an apply button, so I will have to go to the carrier to write that plan. But this WellCare dual Liberty, I can write on here. So I would click that apply button and just do the e-app right away on here, right? There's no additional login to the carrier. This apply button will take you to the app right away to submit to the carrier. Jeff, please do a marketing and lead webinar. That would be very helpful. Okay, Jeff, we got you. Carl, why would I do the enrollment through the platform for a non-comp plan? Um, Again, that's your choice, Carl. The carriers do have these plans available, whether they're commissionable or not. It is, you know, up to you to show the clients what's available to them and to let them know what their options are and let them make that decision on what plan they want to be enrolled in. I'm trying to read through these comments, and if you have more comments, keep them coming. I do see quite a few of you still on here and helping us with the PDP. Carl, maybe that's something we talk about after this training, but I'm happy to have that conversation on those types of plans. Frederick, will only plans that you're authorized to write appear. So that is your choice, Frederick. Again, when you're quoting on here, it's up to you to come over here on these filters on the right where it says My Appointed Plans and to uncheck it or leave it checked. But you can always quote all plans, all carriers, whether you're appointed or not. The only ones that you're appointed with and you can write on here will have that apply button. I hope I explained that okay. If you still have confusion on, what you're appointed with, what you're not appointed with, apply, not apply, just let me know. I'm happy to walk you through that. Okay, I don't see any more questions coming through. Hopefully everyone feels really confident coming in here, entering in their client's information, running quotes, whether it's on Integrity Connect for the Medicare Advantage PDP or CSG for MedSup. And if you need more training or more help on Integrity Connect, all of us here at Eldercare are happy to help you with that. And we hope you all have a fantastic AEP and just know that we are here for you and we'll see you next week. Thank you, everyone. Bye.